defibrillating them, still working them, and it's not going to be a good prognosis for them. If we've taken over care and we're still doing CPR all the way into the ER, another bad prognosis factor. So aggressive BLS, aggressive CPR, aggressive suctioning. Suction is critical in these. I even have siesta here. So I incorporated siesta key into this. Factors that contribute to possible drownings: lack of swimming ability, no-brainer there. Lack of barriers in residential households, no fencing or gates. Lack of close supervision. I had a recent drowning where mom went inside, just like that. Next thing you know, drowning. Lack of close supervision again. So location, home, beach, lakes. That's always going to be a contributing factor there. Failure to wear life jackets, and a huge one here. I was talking about the.
Yeah, it's a good presentation. I'm just add on a couple of things. If you have somebody who you think might have aspirated water, had choked water, but they wake up and they're fine, you know, near drowning we call them. You know, there's always the risk that they've aspirated that fluid, and they can feel fine and go home and go to sleep, and then all that fluid will leach back out of the bloodstream into the lungs, and they'll basically drown while they're sleeping. It's called secondary drowning. So anybody you think might have aspirated water. You guys need to call for help or anything?
Dispatch is Beach 13. We have a drowning patient, adult male, CPRs and polygraphs, AED. We'll meet you at 948 Beach Road, Siesta Beach. Dispatch copies. Shocks advised. I'm clear, you're clear, we're all clear. Shocked.
Okay, right back on compression.
We would just be cranking it all the way up. We're not concerned with our other settings on here. Crank it all the way up. And again, like I say, while they're doing the chest compressions, and you see the technique that I'm doing here, because on a real person, it's critical that you do this little scissoring technique. I'm using this finger to push the tongue out of the way, so I can get this in here. And I'll stick this down pretty far. I'm not trying to like cause any trauma to the airway, but while they're doing those chest compressions, I'm just going to keep doing this. And when they get up to about the 20 count, 21, 22, I'm going to stop real quick, slide my OPA in place, and get this to the base of the tongue at the very bottom, and then turn it the rest of the way. That way they're at 25, 26, 27, 28, 29, 30.
Very cool. So they asked me to bring it up, so I said, sure, I will.
No, it's very
Yeah,
thank you very much. Yeah.
You guys have any questions
for doing this. We appreciate it. Thank you very much.
If I do some compressions, can it tell me, like, you can tell you if you're doing too hard or too soft?
Yeah, it tells you whether you're effective or not, because my concern would be too soft.
I want to see how hard is too hard.
Actually, so do I.
Pretty big dude, so you can probably hurt pretty hard.
A little deeper, right there. That's where I want to be.
Can I try that? Because I've never actually done this on any, like on a live human, and I just want to know what it feels like.
See, it tells me to stop doing it. It's not that I can't see it, but a lot of times I'm not in the same room with the person. A little bit deeper. Deeper.
I might not weigh enough to do this.
Right there.
Yeah.